As you may know from experience, headaches are fairly common in normal pressure hydrocephalus, known as NPH. A Swedish research study showed that 36% of people with NPH, which is about 7 in 20, experience headaches several times a month. Pain is something our members do often report, but the cause is not always the same for everyone, and the headaches you experience at different times might be due to different things. It's important to try and figure out what might be causing your headaches, to try and find ways to help prevent or treat them. Keeping a headache diary can be a useful way of spotting patterns in your headaches to figure out what might be triggering them and what some solutions might be. We have a new headache diary that you can download from the Shine website to help you record when your headaches happen, how they feel, how long they last, what you were doing before the headache started, this helps us to spot triggers, and what you tried to treat the headache and if it worked. Let's now look in a bit more detail at the causes of headaches and how to manage them. While we're thinking about different causes, it's worth bearing in mind that anxiety makes pain worse. We know that anxiety can be something that affects people with NPH, so when we're thinking about pain management, it's also useful to be considering anxiety management alongside other treatments. If you have a new programmable shunt fitted or your settings are adjusted, it can take a while to become comfortable with the way the new pressure feels. You may experience more headaches in the weeks or months after a new fitting or adjustment. Pain management medications and techniques such as cognitive behavioural therapy, CBT, can help you become more comfortable with the changes. We have a new webpage about shunts and NPH, launched for NPH Awareness Week, which you can find in the NPH information section on the Shine website. Shunts can sometimes remove too much CSF from the ventricles, and this is known as overdrainage and can cause low pressure headaches. Low pressure headaches will usually come on when standing up for long periods of time and will usually be helped by a glass of water and a lay down. Because gravity affects the way shunts work, their function is affected by the positions we're in. Shunts don't drain upside down, drain less well lying flat, and drain more readily the more upright we are. If you find you feel okay in the morning, but a headache builds as the day goes on, this could potentially relate to overdrainage. We recommend speaking to your GP about a neurosurgery referral if overdrainage is suspected. If you have a programmable shunt, the settings may need to be adjusted. Unfortunately though, low pressure headaches caused by overdrainage aren't always easy to fix. Anti-siphon devices can be added to existing shunts to try and reduce the siphoning effect of being upright where too much fluid is being drained away. There's a type of shunt called a gravitational shunt that can help. It has one setting for standing and another for laying down, again with the aim of reducing the siphoning effect when standing. If you lose lots of weight, you may need your shunt adjusting to compensate for reduced abdominal pressure and to prevent overdrainage. Exercise can also lead to overdrainage and head pain. Exercise increases blood flow to the brain, and the extra blood takes up space, which can cause a shunt to drain too much CSF, causing headaches. Build your exercise levels up gradually over time and keep well hydrated to prevent overdrainage head pain on exercising. Subdural hematomas are potentially serious complications of shunt surgery in NPH, and one of the symptoms can be a severe headache. The blood vessels and brain tissue of older people and of those with NPH are fragile due to changes in compliance or springiness of the brain as we age and as part of how NPH develops. Reduced pressure in the brain caused by a shunt can pull the firm brain tissue away from the covering tissue called the meninges. This causes some of the blood vessels to break and leads to bleeding in the subdural space around the brain. The collection of blood, or hematoma, that forms puts pressure on the brain, causing symptoms that include a severe headache, sensitivity to light, drowsiness or confusion, nausea and vomiting, and disturbances in vision. The highest risk for subdural hematoma is in the period just after surgery and the first 3 months. It's rare for it to occur outside this window, especially with programmable shunts, but it's worth just being aware of the symptoms. If you do experience these symptoms, then you should urgently attend accident and emergency for assessment and treatment. If you have a shunt alert card and hospital passport from Shine, take them with you, but do not wait to fill them in if not. Treatment may involve surgery to make a hole in the skull, called a burr hole, to relieve the pressure on the brain. Headaches can be a symptom of dehydration. Dehydration is usually caused by not drinking enough fluid to replace what we have lost. We lose fluid all the time just by breathing, sweating and going to the toilet. People with NPH may be more prone to dehydration for different reasons. Memory problems associated with NPH can make it difficult to remember to keep drinking throughout the day. Mobility issues might make it more difficult to make or get drinks. And bladder leakage sometimes means people want to drink less to try and stay dry. This isn't something we advise doing and can actually worsen leakage. More concentrated urine is more irritating to the bladder, and not filling your bladder regularly can reduce how much urine it holds. Keeping a fluid diary alongside your headache diary can help identify if the headaches you experience are being caused by dehydration. We have a new fluid diary that you can download from the Shine website. Lots of things can cause dehydration: the temperature, humidity, the amount we exercise or otherwise exert ourselves, and the amount and types of drinks, for example, alcohol and caffeine consumption, and the food we eat. We can also become dehydrated by illnesses that cause fluid loss through vomiting and diarrhea or sweating from a fever. Having diabetes also increases the risk of dehydration, and some medications can also have a dehydrating effect. People sometimes worry that the CSF being drained by their shunt needs to be replaced by drinking equal volumes of water, so just to reassure you that this is not the case and the fluid removed from the head is reabsorbed into the bloodstream. Some tips to keep hydrated. Drink fluids regularly. You want to be drinking enough that your pee is pale and clear, unless you've been advised otherwise. Water and diluted squash are good choices. Foods with high water content can help boost your fluid intake, for example soups, fruits such as melon and oranges, and vegetables such as tomatoes and cucumber. You need to drink more when there's a higher risk of dehydrating, for example if you're sick, have diarrhea, or you're sweating due to hot weather or exercise. Limit caffeine intake to a maximum of 400 milligrams daily. That's about 4 to 5 cups of tea or instant coffee. Alcohol is very dehydrating, so space alcoholic drinks with water or soft drinks. And if you have been drinking, try to have a couple of extra glasses of water before bed. Talk to your GP or pharmacist about your medication. There may be different doses or types you can try to reduce dehydration and headaches. Good sleep is important for everyone and can help prevent headaches due to tiredness. There's a theory and some evidence that during sleep our brains flush out toxins that accumulate during the day, so your brain is then bathed in fresh fluid. This process is thought to help protect brain health. Our members with NPH sometimes report having difficulty sleeping. The NHS Every Mind Matters website has some great information, but just to cover some quick tips now. Winding down with quiet activities before bed, like reading or meditating, can help prepare your mind and body for sleep. Getting some light exercise or stretching in, nothing strenuous as that can make sleeping harder. Avoiding stimulants like caffeine and avoiding large, heavy or rich meals and fatty foods before bed. Making your sleep environment comfortable, the right level of darkness, comfortably cool temperature, comfortable bed and bedding. Avoid using screens near bedtime, or if you can't avoid them, use a blue light filter on the device or glasses with blue light filtered lenses. Routine is important for good sleep, so try and get up and go to bed at around the same time. Headaches and grogginess in the morning could also be a sign of sleep apnea, a condition where obstructed breathing at night means carbon dioxide builds up in the blood instead of being exhaled. This leads to swelling of the brain with feelings of grogginess, brain fog and headache. Other symptoms include tiredness, snoring, tossing and turning, stopping breathing during sleep, which is something that you may not know about, but someone else may notice. Waking gasping or choking in the night. Awakening with a dry mouth or sore throat in the morning. Lots of body systems are impacted by sleep apnea, including the brain and the cardiovascular and immune systems. We have a web page about sleep apnea where you can read more about it. If you think you might be experiencing sleep apnea symptoms, then see your GP to be referred for assessment in a sleep clinic. Treatment for sleep apnea is usually very effective. Continuous positive airway pressure, or CPAP, involves wearing a mask that delivers a steady stream of air to keep your airway open while you sleep. If the head pain you experience is due to sleep apnea, the CPAP treatment should resolve it. As we age, our visual acuity, how well our eyes see, can change. Annual eye tests at the opticians can make sure you keep up with and correct any changes with the right prescription of glasses or contact lenses. If eyesight that needs a prescription goes uncorrected, you might find you have blurred vision and headaches as your eyes have to work harder to see. When you're managing a lot of health appointments already, and if you do have memory problems with NPH, it can be difficult to remember to keep on top of more routine appointments like eye tests. You might find it helpful to ask the optician to send you appointment reminders and/or to book the appointment around a memorable date like your birthday. Using glasses rather than contacts is likely to be a bit safer if you do struggle with memory problems and might forget to take them out. Contact lenses can cause eye infections if you leave them in for too long. Having your glasses on a string may help if you're prone to losing them. If you regularly use screens like computers, mobiles or tablets, take regular eye breaks. 20-20-20 is a good rule to remember. Every 20 minutes, look at something 20 feet away for 20 seconds. Tension headaches cause constant pain on both sides of the head, neck or face, sometimes behind the eyes. It may feel like squeezing, like something is pressing on your head or being tightened around it. The affected area may be tender and your head may hurt more when touched. Tension headaches can last anywhere from around 30 minutes to several days. The pain can be caused by posture and muscle pain, eye strain, tiredness, dehydration, noise, or tooth clenching and grinding. Depending on the cause, exercise such as yoga or Pilates can be effective. You may need physiotherapy if the pain's being caused by a particular weakness, imbalance, or instability. Massage and hot or cold packs can also help by relaxing the muscles and releasing tension. Painkillers such as paracetamol or anti-inflammatories such as ibuprofen may also help. Amitriptyline is sometimes prescribed to help prevent tension headaches, but takes time to work. Temporomandibular joint pain from tooth grinding and clenching can be relieved with a night guard from your dentist. Migraines are severe debilitating headaches where the blood vessels in the brain release chemicals that cause inflammation and pain. There's no evidence that migraines are more common in those with NPH, but it's a relatively common condition in all people. Migraine headaches may be associated with other neurological symptoms, such as temporary paralysis on one side of the body, or altered sensation, taste or smell. Some people experience visual disturbances known as aura, which might be flashing lights, sparkles or wavy lines. Blind spots or loss of vision have also been reported, and people can become very sensitive to light, sound and smells. Ringing in the ears, known as tinnitus, sometimes occurs. Nausea and vomiting are also common. The causes of migraine aren't well understood. We know it can run in families, and we know that some people with NPH will experience them because they're so common. There are lots of medications that are used to treat migraine, including triptans and propranolol. There's no easy way to predict which treatment will be most effective for you, so trial and error and trial and improvement is the most common approach. Usually you'll need to try a medication for around 3 months to be able to tell if it's working. This can be frustrating, and you may worry that the doctors don't know what they're doing, especially if you have to try lots of different medicines and doses to get something that works well. Try to bear with it though, Everyone is unique, and just trying different things is really the only way to find the right approach for you. Our brains can change throughout life through something called neuroplasticity. This just means that the brain can change in response to our experiences. It's not fixed. If pain lasts a long time, new pathways in the brain are formed through neuroplasticity, and the longer the pain lasts, the more hardwired these pathways become. The brain and the body learn to stay in pain. This does not mean the pain is imagined, it means it is ingrained, and different ways to treat and cope with pain are likely to be needed once it becomes chronic. In acute pain, for example from an injury, our body produces endorphins, which are our natural feel-good pain-killing chemicals. However, with chronic pain, our brains seem to produce less endorphins, so we have less natural help reducing the pain. If you take painkillers for headaches on more than half of all days, you may find you start getting headaches when you then don't take medication. These are called rebound headaches. Once this vicious cycle begins, it becomes difficult to break, and you essentially become dependent on the painkillers. To stop, you should get medical advice and support to help you manage your pain while weaning off your medication. It isn't always possible to get rid of pain completely, but the goal of most chronic pain management programs is to help you find ways of getting on with your life. Ways to do ordinary activities rather than the pain always dictating what you do or don't do. Managing anxiety, learning to properly pace yourself and setting goals regarding your everyday life are as important as medications in your treatment. Most dedicated pain management services will have a psychologist. Referral to one does not mean your doctor thinks you're imagining your pain. They know your pain is real and they want to help you cope with it. Shine has an online pain management course. If you think you might be interested, contact firstcontact@shinecharity.org.uk or call us on 01733 555 988 and ask to be referred to the health team for more information. There are specialist organisations that have lots of good information on chronic pain, for example actiononpain.co.uk, British Pain Society and Pain Concern. What to do? Stay hydrated, protect your sleep following good sleep hygiene, have regular medication reviews, know your shunt, there's a good page on the Shine website about this. Seek medical help to get the cause of your head pain investigated. Following shunt surgery, if you experience symptoms of subdural hematoma, get them checked in A&E as soon as possible. Once serious or dangerous causes have been ruled out for headaches, it's helpful if you can accept this, with the help of psychotherapy if needed. If you have headaches often, it can be useful to record them in a headache diary. You can download one from the Shine website. If there's treatment available, be open to trying it, including things that might sound strange to you. For example, antidepressants like amitriptyline and epilepsy medications can be used off-label for different types of pain. Or non-medicine-based treatments like physiotherapy or cognitive behavioural therapy can be very effective if you're committed to the process. Unfortunately, not all pain has an obvious or easily treatable cause. You might need to try lots of different things in different combinations to find what works, and you may need to switch or adapt your pain management strategies over time. Anxiety or catastrophizing, always thinking the worst, can make pain significantly worse. No one has ever been able to just calm down when told to, but there are effective strategies to help manage anxiety that can significantly help to cope with pain. If you would like to see a written summary of the information in today's presentation, we have a new page about headaches in NPH available from the NPH information section of the Shine website. If you'd like some one-to-one support or are interested in our pain management course, our email and telephone details are on the screen. Thank you for listening.